professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And I just wanted to really quickly go over this paper, really interesting paper published in the Journal of American Medical Association, one of the top premier journals. I've actually published with them as well in collaboration with the National Institute of Health. But this was not one of my works. But I wanted to emphasize this work because I think one area that is oftentimes neglected, we don't do enough to try to emphasize, is the health-related social needs, and so health related social needs are in fact something that has been identified as important, and so there's this large national survey of Medicare Advantage beneficiaries that were put together to kind of provide information on certain health-related social needs. So what were those identified as? And I think that is the more important question than the definition of health-related social needs. So what that was defined as was specifically food insecurity, financial strain, loneliness, unreliable transportation, utility insecurity, housing insecurity, and poor housing quality. So these are actually, if I look at them, look at these 8 HRSNs, they're not very common, should I say? I think are there 8? I think there's 7. So there's 7 factors that are incorporated into this cross-sectional study. And this is Medicare Advantage. So again, those of you that are epidemiology trackers, it's a cross-sectional study, and the measure of association that was used here was, and if you guessed, if you guessed, so here's the answer. If you guessed the odds ratio, you were correct, but out of the odds ratio, there's some additional ratios that you can calculate. And so one of those, if you do calculate, if you convert your beta estimators, then you can actually calculate an incident rate ratio, and sometimes that might provide a little bit more insight than just an odds ratio. So let's see in the methods section if there's any additional information on how. So I was right, there were actually 7 HRSNs that were identified, and so those were it. And then if you look at the supplement information, it's for some of the additional findings. I think that's something that can be looked at afterwards, but looking at the method section, some of the measures, some of the participant characteristics were age, sex, race, and ethnicity. So then, if you took a look at the race and ethnicity, Asian, Hispanic, North American, Native, and other race or ethnicity was also measured. And then the primary address during the survey period. So they had information, geospatial information here as well. And I'm really I'm really wanting you to also pay attention to some of these comorbidity indices. These are pretty important and provides some insights as to how much of an effect sets of diseases have on the individual. So the other question was during the statistical analysis how the IRR was calculated. So to enable comparison across groups, the incident rate ratio was calculated, and this was associated with the presence of HRSNs. So there you have it. They used SAS to guide their analysis. So, looking at the health related social needs, then finally, they kind of broke it down by health related social needs. And naturally, one would be more than two. But what was really important here is that a lot of these avoidable hospital stays and so when there was a higher health related social need, like greater than five, then avoidable hospital stays were actually increased. Not necessarily all cause hospital stays, but definitely avoidable hospital stays. So what was interesting is that as the number of HRSNs increased, the hospital stays increased. Incident rate ratio of hospital stays increased as well. And similar patterns were at rates of emergency department visits. So, a couple of important points here. Hospital healthcare utilization increases in the wrong ways. Healthcare, of course, healthcare utilization should increase for preventative care, but unfortunately, what happens is when you don't have a healthcare system that supports all the individuals of the population, then acute care utilization goes up, and then chronic diseases are being actually managed in acute care settings. And that's a disconnect that needs to be addressed, and definitely one that requires a lot more important research like this one, which just came out actually yesterday as of this recording, in order to better understand chronic diseases. So, a couple of things that are here are comorbidity indices. Pay attention to those. Healthcare utilization, how that takes place. Emergency department utilization, how that's measured. And then what some of the unique health related social needs that were identified within the contents of this study. These were ones that are being looked at more currently. So a lot of these are changing in a state of flux, but if you look at some of the premier journals, like the Journal of American Medical Association for ideas, then 9 times out of 10 you'll find the idea or the topic that you are most fond of or that you are currently looking for. Thank you for listening.